Good morning. Welcome, everyone. My name is Michele Floriani. I am the Chief Marketing Officer at Sequoia. Really excited to be continuing the Return to Work webinar series. Great to have you all back for another session. Very excited about the content and the speakers we have today. I'll walk you through that in a second, kind of take you through the content. As we always do, I want to remind everyone we have some experts and thought leaders and HR professionals here today, but they're really just sharing their opinions on what they have been seeing. As an audience, we should always be referring to official resources and our own professional resources around us as we navigate this COVID era. So, very cool webinar today. It is action-packed. I think we're going to cover some great content. We have some good pace to it. We're going to start off with some more announcements, and then, of course, I'll introduce the first panel and our speakers. The first thing we're going to hear to kick off the day, to dig into really what it takes to really provide effective well-being in a COVID era, is we'll hear from the Chief Medical Officer from Crossover Health, Dr. Stephen Ezeji-Okoye, and he has some great kind of very concise but impactful content to help really frame what employers really need to be looking at and understanding that's happening to our people during this kind of work from home COVID period. We'll unpack that further as a panel. There is going to be some great minds covering emotional health, physical health, Headspace, Rightway, Physera, Crossover, with a pretty broad view of how this can go. So we'll go a little deeper on that. And then we'll flip and look at this from a client lens. So from HR and benefits practitioners and leaders leading the way, what's happening in their environments. Our Director of Wellbeing, Kaleana, will take us through that conversation and moderate that half, which I think will be equally rich and provide some good, useful insights. And then we'll close with some closing remarks. So that is our session. Glad you're here. Excited to dive into it. This well-being topic is one that is very near and dear to our cause and our reason for being at Sequoia. So this is a special one for us, and I think you'll be able to see just really what we're excited about on this topic, both inside the walls of Sequoia and for you all as well in the audience. As a reminder, always, everyone's in participant mode. You can use the questions function. We collect those. It drives everything from content to FAQs and other things that we release in between or during the next webinar. So thanks for that. And we will put the recording. That's probably the most asked question I get. We do all these webinars. We put the recordings on sequoia.com, and you can access them through the Return to Work page or through the events pages, naturally. Okay, so when we did our first Return to Work webinar a little over 45 days ago, we launched and announced the Sequoia Return to Work framework, which was really our synthesis of the 5 key pillars or categories, if you will, that go into a plan for returning to work. It was a way to kind of frame up the problem statement as well as the solution or the requirements for a solution. And it drove things like our playbook and whatnot. Then a couple weeks later, we had a webinar series dedicated to announcing the Sequoia Return to Work Center, which was our software solution for helping companies in their return to work. Naturally, it was designed to fit into the 5 pillars of the framework and talked about the roles of businesses or employers and the roles of employees and what they needed to do and the requirements of that to return to work safely and productively. And then in our last webinar, we announced the launch of the Sequoia Return to Work Playbook, which really did take a lot of the thinking and synthesis that had gone into everything from the framework to this Return to Work Center, but also broke it down. And really it's just a tool, right, to help people again, think through how a return to work strategy, whether you're doing it with Sequoia or doing it on your own or doing it with somebody else, just some of the considerations. And there's naturally a lot of great playbooks out there. I encourage people to read all of them. They always have something to offer and a different bias and emphasis that helps people think through the possible paths back to the workplace. whether that's happening this month or happening, a year from now. Today, I'm very excited to add to that announcement that we are in full general availability of the Sequoia Wellbeing module in HRX. I'll give a little context for this, but it's something that's been part of the HRX launch that started back in March at the Grove. It's fully functional with all the features we've always intended, and so I'll show you a little bit of that. And it was part of that also the Sequoia bundles for Wellbeing. But again, as I said, well-being for us has always been a very natural extension of the healthcare conversation, of the taking care of people conversation. In our platform, as you may recall, if you've been part of these series, as we talked about the platform and the return to work solution and what its core components were, our approach to well-being is very consistent with that, right? Which is, businesses need a place to bring all of their well-being program information into one place so they can better manage, administer, and make decisions on those programs and how they're taking care of their people. And of course, on the employee side, people need a way to consume that easily, right? We have a strong belief that access equals utilization, utilization equals appreciation, appreciation equals return on investment, not just for retention, but because it's helping your people. It's making them more productive. It's making them healthier. It's keeping them more balanced, et cetera. And the platform is what enables that, connectiveness between the management and the utilization of well-being. And that's what we have effectively done in the platform for how well-being is done now at Sequoia. We've digitized our service, and we've done maybe in a more analog way over the years, in a way that we think is how people want it, right? Which is much more immediate, much deeper access to information, and the decision-making and discovery that goes into producing and maintaining a well-groomed well-being program for your company. So good way to think about it is, particularly if you've been following along in these series, webinar series and the announcements we have, is that, HRX is the tool we have for HR and business leadership to manage their programs and their people data and all that good stuff in one place. And obviously the mobile apps where it comes together for employees. Well, for the same reasons that works so well for well-being is why, of course, it works so well for return to work. And, I'm showing them here as two separate screens, but obviously, the return to work and the well-being, when it's connected in the same context, we feel is the complete solution, because you may be returning to work now, you may be returning to work, and, as I said, a year from now. Regardless, you need to take care of your people, and that dynamic communication that is happening now, that's required to happen because of how everyone's distributed and because how companies need to stay, in good coordination with their employee and their workforce set. That's why the taking care of people through well-being is a good place to have it all in the same spot, right? There's very acute scenarios. You could say, like in the context of return to work, if somebody does go get tested, does discover they have COVID, they need to be taken care of right then and there. And that's, again, why having it all connected is a complete answer for people. But it's equally important for the management of all this and having it all on one pane of glass, the people, the data, the connection, the utilization, the understanding. So a little bit about that. I'd be happy because, a lot of our clients, I realize we have a lot of non-clients on here, so hopefully this is equally interesting to you, but a lot of our clients have been exposed to HRX as it's been rolled out. But I just wanted to take a second and just show you what's actually happening in the well-being section, because it's a great way that we bring awesome partners like we have on the call today closer to you so you can understand and discover and appreciate their value. So let me just switch over real quick. So we are here in HRX. And so if this is the first time you're seeing it, this is basically the management tool we have. You have all your programs on the left-hand side and your Sequoia team, of course, that you can access, and other key information about your population or tools you may use, tools Sequoia supplying you, et cetera. So on the left, what's really cool is now in this well-being section, you see your programs. So all your well-being programs that you're subscribing to, Headspace is on our call today. Let's check them out. In this case, you know, you get some high-level information. Maybe the decision maker brought Headspace has moved on, or you have new people adding to your team. They can quickly understand on the management level why, you know, you got Headspace, what it's all about, some resources about it. You can see if there's any, you know, newsfeed information that Headspace has been pushing out to people that you could leverage for your own education or for your people. Reviews, and so Greg Olive, our CEO, who rightfully said this is the Sequoia account we're looking at here, put in a review about his appreciation of Headspace. Obviously, other clients do as well. So that's the kind of idea of how vendors are maintained here. And then the really powerful thing about this is the discovery of other vendors. So as you're having your strategic meeting with your Sequoia consultant, and maybe there's an aspect of your employee health you want to address, you can go through here. You can, of course, search for certain kinds of vendors, discover new ones. We have today Physera on this call, so grant them a little airtime here. Learn about Physera, understand there's different resources that they've made available, et cetera, and obviously facilitate a discussion. What you also may have saw, this is something that is new also this week, is Sequoia bundles. So in the same way we've put vendors in one place that you can discover and learn and roll them out to your people, we've just advanced that to put bundles together, which is, here, let's just explore here, this bundle for Wellbeing. For Silver, they come in about 5 different kind of metal categories. Which is really the volume of vendors that you have in each set. And in here, really what we've tried to do is make it super streamlined, you know, one contract, one bill, and a lot of affordability because of the way they've been bundled. And so same kind of thing. You can learn here that this is actually specific language for what you get through the bundle. You can learn about them, discover, and understand based on your account. And it's actually quite easy here. There's an agreement form, of course, you can download, or pick the month you want to get started with that vendor set, and then on you go. It kicks off the process. What's super helpful is when you are in that mode of having a bundle, you can always, these will push out to the mobile app on your effective day. So saving a whole lot of headache. I often joke that HR almost finds itself being a product marketing organization trying to drive awareness and utilization of what they're helping to sponsor for folks. In this way, it just shows up in the app, as you saw, and the discovery and utilization tends to happen on its own. Or if you want to promote something, you can always go, and if you like an article from a vendor, hit share and share via email or via other methods, or up here, this is the other cool thing in the news feed, all our vendor information, so we can just filter real quickly on well-being information. And here's the webinar from today. Let's find a good one here from Physera. I can share directly to the mobile app. So all of our employees would get this message and the link to the reference material from Physera. And so things that are for your people are labeled that way, but HR can always make a decision what they want to send. Here's a cool one from Headspace about what's going on in our community and what they can do about it. Again, you can share it with your people. So anyway, pretty fast. If you want to dig in more, obviously contact your consultant, and I'm sure they would be happy to go through that at Sequoia. But we're very excited about that. Thank you to our partners and vendors, and thank you to everyone on the product team who's put some great work together to make that really easy for our clients. Other quick announcements. So the testing tent at our San Mateo office is live and well. So One Medical subscribers can come in here if you're in the area, and they also have some opportunities for people who aren't subscribers to come in and get tested if you are interested in that. Check it out. 8:30, 3:30, it's doing a lot of good for people as they're re-entering the workplace. All right. Cool stuff. Excited to get into this conversation. Again, the center of this is really how can we best take care of our people? What's happening? You know, we've now been at home for months, starting to understand some of the cause effect of this disruption on our people, and also the factors on, you know, as we start to return to the workplace, some may come back, some may not. This actually adds some complexity to how we think about that care approach. So to really set the table today, I wanted to ask Dr. Stephen Ezeji-Okoye to kind of set this table for us, and Crossover, who does some really wonderful work, and I'll introduce them formally in a sec. One of the things that they have is a very broad view of what the needs and the claims are that they are seeing. So excited to have you, Doctor. I'm going to hand it over to you to take us through some of the kind of opening content. Thanks for being here today.
Thank you, Kelly. So COVID-19 is going to fundamentally change the way we work and how care is delivered. For example, pre-pandemic, Crossover was delivering 98% of its care in person. Since the pandemic has taken hold, now 90% of our care is delivered virtually. Also, we're seeing tremendous changes across campuses. Campuses are either empty or only have essential workers. And what we're hearing is that people may return in a limited fashion, and in some cases may not return at all. And so the landscape of how we look at where we work and how we deliver care is going to look quite different in the post-pandemic era. So the new reality is that as we move from being largely based in the physical space to having a greater presence in the digital space, we're going to have to learn new ways to interact with one another. What can be done virtually, what will require us being in person, and then also just the dynamics of what this period of social isolation and social distancing will do, and how this is going to affect the way we work, even as we return to what the new normal will be. There's going to be new stressors and new environmental pressures that are going to affect how we feel about our work, how we feel about ourselves, and in general, how we feel about our health and well-being. One thing that has definitely occurred is that we're experiencing a growing financial burden. We're seeing increased levels of unemployment, levels that haven't really been seen since the Great Depression. And on top of that, more and more people are experiencing reduced income or going through periods of furloughs or anticipating that they may be laid off. And it's thought this could affect as much as 1/3 of the United States workforce. And so this is becoming an increasing source of mental stress. We know that the thought of job loss is increasing how people feel about what is going on top of the existing worry over what is likely to happen if someone is exposed to or contracts COVID-19, or what will happen to a loved one. And then the period of social isolation that's occurred can also contribute to poor mental health. We know that social isolation and loneliness will increase the risk for exacerbations of mental health conditions amongst people who have a pre-existing mental health condition, but also the negative effects of social isolation can exacerbate or bring up new mental health issues, particularly in those populations who are most vulnerable, such as the elderly and adolescents. And we know from research that job loss has major impacts upon depression, anxiety, as well as feelings of low self-esteem. And with that may come higher rates of substance use as well as suicide. In addition to the mental health effects, social isolation is also disrupting our patterns of activity. So people who were previously quite active are now placed in a state where they're going to be less physically active. And those people who already were sedentary or largely sedentary are likely going to have reduced level of activity. And this is likely to lead to further health effects such as increased weight gain or exacerbation of chronic conditions such as back pain. And one of the key questions is that once things begin to relax a bit and the periods of social isolation becomes less pronounced, will people return to their previous levels of activity, or will they be less likely to pick up new activity if they were previously sedentary? On top of those effects, we also have the issue of the recently highlighted issues of racial injustice and concerns about systemic racism and bias. And this is just further compounding the feelings of stress and anxiety and worry amongst people. So on top of all of that, the recommendation from the CDC during COVID-19 was really to focus only on urgent care needs. And so as a result, both healthcare settings and patients have really just focused on acute and urgent issues. A consequence of this has been that routine health maintenance, such as immunizations or screening examinations, have not been occurring, as well as people have been putting off having care delivered around their routine health needs. So if they're diabetic or if they have high blood pressure, making sure that those conditions are under control, have taken a back seat to avoiding a contact with people who are ill or avoiding the healthcare place, if at all possible. And this is likely to lead to an increased burden of disease as these conditions may worsen due to not having been monitored, as well as there being an increased demand for service when people are trying to catch up on all this deferred care. So in total, we're seeing that COVID-19 is having an impact on our mental health, our physical health, as well as our generalized feelings of health and well-being, as well as our acute and chronic disease issues. The mental health issues brought on by economic uncertainty, increased isolation, grief over the death or illness of loved ones, the relationship stress that occurs either because people are placed into closer contact for longer periods of time than they are used to with their loved ones, as well as the distance that may have occurred where people are not able to maintain their usual relationships or their usual communication with loved ones, all contribute to the stress that people are feeling. And that just compounds the stress that already exists because of concerns about the COVID-19 virus and the feelings of racial and social injustice. And so while we may recognize things such as feelings of anxiety or depression, we also have to realize that mental health issues may also present themselves as physical complaints or somatic complaints. So increased feelings of headache, fatigue, stomach pain, or musculoskeletal issues may be manifestations of mental health issues. And with this increase of mental health disease, there is the ever-present danger of self-medication. So that people will attempt to deal with their issues of loneliness, their issues of depression and anxiety and stress by increasing the use of alcohol or substances. And one of the things that often coexists with mental health issues and stress is insomnia. People's sleep patterns are disturbed, and this lack of sleep actually exacerbates the feelings of stress, the feelings of depression, the feelings of lack of energy, and this becomes a self-reinforcing cycle where the depression gets worse, the insomnia gets worse, and so on and so forth. Also, we're likely to see increased amounts of impact upon people's physical health. So the weight gain from lack of exercise, and then seeing physical complaints such as neck and back pain that are brought on by our home environments not being well adapted to work. We likely are working from workplaces that have poor ergonomics, and that's going to lead to neck injuries and back injuries from prolonged sitting. And the increased number of Zoom meetings that we're having or just video conferences is going to lead to increased screen time, which may manifest itself in eye strain and headache. And then just the fact that we're stuck into a much smaller areas that we feel comfortable moving around is going to lead to just an increasingly sedentary, which may exacerbate the weight gain and also musculoskeletal injuries. Our overall health and well-being may be impacted not just from us having neglected our routine health care as well as our chronic disease management, but also neglecting our self-care, like our exercise routine, our routines of engaging with loved ones. And then also just poor nutrition where people don't feel comfortable going out to shop. So we're having increased reliance on delivered foods or fast foods, which have increased amounts of salt and fat and calories. And so what we're really seeing is that the COVID-19 is causing a whole person problem. And a whole person problem really needs to be addressed with a holistic approach. And the biopsychosocial approach that we practice at Crossover, where we have comprehensive care teams that consist of both mental health professionals, physical medicine professionals, and primary care professionals, allows us to address mental health conditions, physical conditions, as well as preventive, acute, and chronic disease issues. And this, I think, is important because the way that diseases manifest we only see a portion of what people are fully experiencing, and we need to be able to delve deeper into what may actually be going on with a person. And coupled with that, we need to make sure we have increased employee communication. This is a time of social isolation, and by being able to do proactive outreach, it allows us to let people know that we're there to support them and to help them. And we also want to make sure that we're providing information that may be relevant to their current events. Examples of some of the things that we've done at Crossover is reach out to people to let them know about ways to deal with stress, to deal with their relationships, how to get better sleep, and how to remain fit and eat well during this period of isolation. And just to reiterate, we want to make sure that when we're looking at our patients or our employees, that we remember that the symptoms that are manifest may only be the tip of much greater problems that that employee or that patient is feeling. And we need to make sure that we're taking a suitably broad approach in our evaluation and our treatment of those individuals.
Great. Thank you, Stephen. Wow. Talk about give it to me straight, doctor. It's a pretty dire but very real scenario. And I think it's honestly why we have so many hundreds of people on the webinar today, because we're starting to sense that this is something that can lead to more things that need to be addressed as they continue to evolve. So thank you for synthesizing that so effectively for us and putting it out there. Excited to now double click down with other people who've been part of this conversation, each bringing their specialty to the discussion. First panelist, the brand needs no introduction. Headspace is a much loved service, certainly at Sequoia and by many of our clients as well. Today we have Lindsay Crittendon from Headspace, who leads their B2B program, basically helping to serve the needs of people through the employers. We have Feldman, the co-founder and CEO of Rightway, which is equally well appreciated concierge service that actually is part of the Sequoia app experience, which is where a lot of people get discovery of them in our world, but a lot of others use them for matching people in need of care with the right kinds of doctors for their network and the right level of specialty and at the right cost. So great service on there. Physera, a very exciting brand, has some exciting news, recently purchased by Amada Health. But really attacking the physical part of this, virtual physical training, which was, pretty relevant before COVID, incredibly relevant now that we're all at home, but really looking at some of the pain management and other techniques through physical therapy. And of course, Crossover, who you just got a taste of their philosophy, their very unique, connected, forward-looking health care network. That's really bringing it all together, thinking about the client experience, the patient experience, and really progressive and a great fit for large companies, employers looking to bring that kind of experience to their people. So, ladies and gentlemen, thank you for being on the panel today. Appreciate you bringing your expertise in emotional and physical and broad view of what patient needs are. First question. Real quick, so you guys see the numbers. I'm sure you manage your services. I'm sure you've seen a lot of change in the last couple of months. For folks, maybe just synthesize for us, something that really sticks out about how your services have changed. That's an indication of the need changing. And so, Jordan, let's start with you real quick.
Yeah, I think the two elements that really stand out are mental health and virtual primary care, virtual telemedicine, virtual specialists. The paradigm in the landscape has changed significantly, as Dr. Okoye was saying. And the way that we procure care, the way that we seek care is probably permanently evolved. And I think trying to educate consumers about that shift and what it looks like, the manifestation of that has really been in mental health and virtual care, which correlates very strongly with what we're seeing from kind of the externalities of COVID. So those are the two areas of care that we're seeing really change.
Yeah, and the need to help them be better patients by being more aware of the options in the model shifts. That's great. Jocelyn, Physera, I'm sure, has seen a lot of change in the service behavior or the need behaviors. Like, what is maybe an interesting angle from that perspective?
So there's already actually some literature coming out around this that we're using to expedite our implementations. But previous to COVID, less than 25% of individuals surveyed even considered remote treatment as an option. And now we're closer to 2/3 of individuals surveyed say not only would they consider care or they're pursuing it right now, but they're looking for it actively. So we're seeing an uptick in utilization as well as really shortening that implementation timeline so that we can get people care immediately, particularly with something that is traditionally in person. You got to really shake the norm and get people used to doing this remotely. Yeah, and then that's what I'm hearing that you're kind of providing evidence as employers. We, probably pre-COVID, we had to spend time convincing people that this is a legitimate way to get care. That's now shifted to like, no, this is the way you get care. if you're, not going to leave your house or you have other concerns about going places. So, okay, very interesting. Lindsay, from a Headspace perspective, I mean, obviously there's a big, emotional, mental health component to what people are going with. I think we'll hear more about that as we go through this conversation. But anything interesting in the utilization behavior? Headspace perspective? Yeah.
Yeah, absolutely. I mean, the utilization and just demand for the services is outstanding. And, we've done some research around that, and what we've learned, and this is for all of our members and not just, enterprise customers, but for all of our members, they need more. Like, just in terms of the traditional care modules are really changing. Actually, they want something in their pocket they can use immediately. They want something that helps them with, not just mental health, say diagnosable conditions, but they actually want something that helps them in a broader sense. And so it's really incredible. We've seen our business almost double since the crisis, actually. So pretty incredible. Wow. We've done our best to give it away, actually, to as many people as we can through unemployment programs and via different states. So also trying to just meet people where they are.
Lindsay, what topics are any them swelling more than others in this?
Yeah, absolutely. So we have a pretty well-developed approach to stress and anxiety, which I'm sure, that is probably not a surprise, but that is the primary meditation content that we're seeing people use. Another thing that's really helpful is we have an entire sleep module. I think if people are feeling stressed, we've heard them say they're a little hesitant to be like, oh, I'm stressed, I have anxiety. What they are more willing to do is admit they're not sleeping well. And so what we found, that's actually a really incredible on-ramp for people to go from curious to using to, oh, wow, this can help me in a broader sense outside of my sleep.
Cool. Well, so let me stick with you, and I'm going to answer the question here. This is my favorite question. We always gather to talk about employees and, people's people, right? But we rarely talk about is actually the HR folks that are many on this call representing people. And let's just take a moment to honor and acknowledge what is happening with HR professionals right now. What have you seen from your lens and your interaction with them?
We work with a little over 1,000 companies right now. So we get to hear from a lot of HR leaders, and we consider and we act toward those leaders as if they are, and I do truly believe, frontline workers in this crisis. Yeah. They're not necessarily in the hospitals, but they are in all the other places where people kind of have the most stress in their life. We did a survey recently. It just got out of the field 2 weeks ago and I'm sure HR professionals, you're feeling this if you're hearing it from your employees or, you're looking into it yourself, but 83% of employees expect their companies to have a mental health solution available to them. And what's really interesting is that when we've asked those questions before, the numbers were certainly lower. It was only about roughly 55%. But when you contrast we really need this with a lot of the traditional solutions, say like an EAP that has maybe a 1 to 3% utilization rate, you definitely see HR leaders just like, what can I do, and really exploring outside of the box. So, you know, and for HR leaders, just some of the other research and things that we're seeing is that, you know, 66% of women in the workforce report being extremely stressed. So at the highest level of stress that they might report, which that also is really incredible, especially as we're looking at, you know, work-life balance and some of the commitments in the home. I think what also is really interesting is that, you know, mental health, about 44% of people believe this should be a top priority for their employers, and are not really convinced that it necessarily is. So there's a lot of reason to be out there looking at all of the solutions that you can get your hands on.
Yeah. Cool. Let me advance to something I'd love to hear from everyone on here on the panel. But you know, the office for many has moved to the home. The home, in many cases, does not have an actual office. There's a lot of adaptation, a lot of people getting by. It's obvious, you know, for some, they're not going back to the office anytime soon. Others can't wait to go back. Like, there's a whole bunch of stuff. But the reality is, this grand experiment of humans working from their home is now a couple months old. And we're starting to see some cause and effect of it. So what are we learning about the impact from working from home? Jocelyn, let's start with Physera, because I mean, I'll tell you from personal experience, sitting in a chair in front of a Zoom conference call for, you know, multiple hours a day definitely changes how my body works. What are you guys seeing, or is there anything interesting that you're seeing happen on a symptomatic level?
Definitely. This is across not only our book of business, but there's pieces being published out of the UK, across the US. And we're seeing an uptick of about 2/3 of the people who are transitioning to working at home are reporting new MSK conditions. So we're seeing a major uptick across MSK conditions, but a kind of funny one that we weren't expecting that our clinical manager brought to the front was we're seeing an increase in foot pain. So many people don't wear shoes at home, and they're used to wearing some kind of support or sneaker during the day, that we've seen a pretty non-incremental, it's a big jump with foot pain. So in response, our team actually has put together these webinars and educational touch points for these client populations to try and help them with their ergonomics at home, head to toe. So it's not just your back and neck looking at the computer, it's actually your feet. Just getting out of the norm and closer to kind of the new norm.
Yeah, interesting. Jordan, that is fascinating. Jordan, I'm just interested from your lens, are you seeing symptoms, an increase of things that you can tie more to, like working from home symptoms? Yeah, what are you seeing?
No, absolutely. Look, I think even the Zoom presentation we're on, and the ability to gather in a virtual setting, and people's appreciation towards the effectiveness of, you know, virtual tools to solve their problems, is really starting to permeate into the healthcare landscape. People's willingness to try telemedicine, people's willingness to try, you know, telepsychiatry, people's willingness to try virtual physical therapy is at an all-time high. That's a great thing, in that it's accelerated some of these, you know, innovative and transformational tools, but it's really put pressure on V 1.0 of a lot of these virtual tools and digital therapeutics. The way that these have really been designed historically was for a limited use case, and, you know, they kind of parachuted in, they would solve a problem, and then they would remove themselves. And I think as people get more and more comfortable with the future of, you know, virtual tools and point solutions in healthcare, the expectations are rising, and the appreciation that these should be able to solve more of the longitudinal problems that actually exist in healthcare, and be able to follow you and coordinate your care continuum, have just been elevated. So I think there's this orientation, and McKinsey put out some great work on this. There's this orientation and appreciation that, you know, virtual care delivery is here and here to stay. It can actually be fairly effective, but it's really raised the stakes for what these digital therapeutics and point solutions are bringing to the table in terms of how they're going to coordinate, how they're going to be leveraged with kind of the traditional care environment. So it's a really unique dynamic going on.
Yeah, and we can see, I think, hearing from Lindsay as well, like there's the emotional connection from working in the workplace, the physical connection. Jocelyn, you're talking about, like it's building up. So last question for this panel, and I'm going to hand it over to Kaleana. And Jordan, why don't I stick with you since I have you on mic, so to speak, and then we'll go to Stephen next. So what aren't people talking about enough, right? So we had the chance here to hit a couple parts, but as you kind of back up and you look at what the doctor covered in his up speed, like what's top of mind for you about what people should maybe talk more about?
Yeah, I mean, we're here talking about return to work, but there's this parallel universe of, returning to the healthcare landscape. People have avoided care, put care on hold. There's been a 50% reduction in acute heart attack and stroke presentation in the ER. It's not because people aren't having the strokes and the heart attacks. COVID is probably leading to more of them. There's been a reduction in elective surgeries, diagnostic and imaging, because people are fearful. The American Hospital Association is trying to push people to say, you can return to that elective care. You can return to the ER for an emergency. So, the same way we're thinking about all these challenges on return to work, the paradigm is equally, challenging and equally frustrating to say, how are we going to go take the last 3 months where the healthcare pendulum has swung all the way in one direction back to the other direction with some semblance of efficiency and effectiveness. And that's really where, I think a navigation tool and an advocacy platform in saying, okay, you've put off care for 3 months. Your chronic conditions didn't go away just because you've ignored them. So as you re-enter and as you emerge back into the environment where you're willing to, whether it's using a virtual tool or going back to the urgent care or seeing your endocrinologist, how do we give you the support, the advocacy, the guidance to go be a better healthcare consumer in this completely transformed landscape? And I don't think we're talking about, the pendulum swinging back and what that looks like. I think a lot of companies have benefited outside of the shock claims related to COVID, that these elective surgeries and, diagnostic imaging have been put on hold. So claims look good right now. But as this pendulum swings back, it could come back with a vengeance if we don't think about what this re-entry into a completely transformed healthcare landscape could look like. And there's a lot of opportunities to improve, right? If we can vend in these virtual tools and digital therapeutics, and we've accelerated, some of the best innovation in healthcare by 5 or 10 years. But if we're not careful about helping people re-enter, I think we're going to see the pendulum swing back further and the cost increase over the next 12, 18, 24 months in a pretty substantial way.
Right, we can predict how that movie ends. Good insight. So, Stephen, we started with you. Why don't we end with you with a couple quick thoughts, and then I'll hand this over to the client panels eagerly waiting. Your thoughts, Stephen, on just what aren't people talking, and that's maybe a soundbite or two.
Sure, thanks, Michele. So one, I think we have to appreciate that just as going into socialization with COVID is a stressor, returning back to campus is also a stressor. And people need to also appreciate that what we may see is people reporting their most worrisome or most significant symptoms. And I think what we need to be looking at is this is an opportunity to shift our focus from just being so disease focused to really having a much more holistic approach, because this is really something that is an opportunity for us to rethink the way that we're delivering healthcare, to focus on a more of a whole person approach, a more of a health and well-being approach, and not just to focus on what is most obvious or what is just the symptom of larger problems.
That's great. Thank you. Guys, I wish we could do this for a week. It was very cool. I appreciate your insights and thoughts. I want to hand this over now as we pivot to lessons really from the front lines, as I said, whether it's in the workplace or at home, hearing the voice from HR. And so, Kaleana, Quibell, who is our Director of Wellbeing. I'm very excited to have her moderate this next panel. So, Kaleana, I'm going to turn it over to you to take us home from here. I'll talk to you in a little bit.
All right. Perfect. Thanks, Michele and everyone for contributing. That was so interesting. So we're going to discuss a few lessons from the workplace. I'll skip real quick introductions, but basically we have Jackie from Snap, who leads their global wellbeing program, Emmaline from Dropbox, who also manages their global perks and wellbeing, Celeste of Crossover, CPO, and then myself, who will moderate through this. So really excited to kind of segue from that conversation that we started into the world of what actually are tangible examples of what we're seeing some of our clients do, which is great. So I'll go ahead and transition to the first question here. So I would love to hear from you. What are some of the lessons that you've all learned about rolling out new well-being programs to support your employees virtually? Emmaline, I'd love to start with you. I had the pleasure of visiting Dropbox in your brand new, beautiful office right before this all started, and you've always done so many great things on site. So would love to hear from you about how you've made that transition virtually and taken that experience to the computer and technology.
Yeah, thank you so much, Kaleana. As I'm sure everyone on this call has experienced, we definitely had to learn things really quickly, and everything just moved so fast as we transitioned from, business as usual to everyone working remotely and, trying to create this new normal as we continue on. Our decisions were driven a lot by listening to our employees and their needs to really help us drive the decisions and changes that we made. Right when we all started working from home, we got a lot of feedback from folks that, their work from home environment just was not conducive to working, let alone being productive. So there were a few things, that we immediately jumped in and started to do. Obviously, like sitting on your couch, hunched over at a laptop, working all day is not comfortable and definitely not productive. So we immediately opened up our global wellness reimbursement program to cover ergonomic equipment. So folks could have like a comfortable chair, a desk, laptop stand, to make sure that they were comfortable and, working well. We also launched a productivity allowance for technical equipment like monitors and headphones, keyboards, things like that. Now that, we need more than just a little laptop screen at home to really do our jobs. Another big thing that popped up now that everyone is at home, including roommates, partners, spouses, kids, folks are on Zooms for work or school all day. Internet was, a big issue that was popping up for people. And it's also really what drives almost everything that we do nowadays. So we implemented our internet allowance to help everyone really make sure that they were set up for success with, having internet speed that could assist them in doing everything they needed to get done. My personal favorite, of course, we really wanted to make sure that folks felt supported in their well-being throughout all of these changes. And it started off as a Slack channel or work from home wellness program, and it quickly grew to over 600 employees from offices all over the globe and all locations. And it started off with really just our gym managers posting workout videos and playlists, healthy recipes and wellness articles, to help that community build and, drive engagement. And we then we moved all of our on-site, fitness classes and meditations to virtual and opened it up over an array of different time zones. So employees, no matter, what location they're in, are able to take advantage of daily stretch breaks and meditations, cardio and yoga classes, to help keep them moving and keep, that routine and, things that they were used to having in the office there with them at home. As we've talked about quite a bit in this session, mental health became a huge focus for us, especially as, you know, the weeks turned into months and things just became more and more difficult, especially with, you know, folks having their children at home and folks also, you know, being alone during this time. So we were able to launch a partnership with Modern Health to help employees and their dependents globally through coaching, therapy, digital programs, and meditations to help support them and improve their mental health and reduce stress and burnout during this really difficult time.
Yeah, that's so great. And it's really interesting when you were talking about that. There's a lot of synergy between, Jackie, I know what you've done over at Snap. And this is interesting when we were talking about, you know, Physera brought this up and a few of the different people as this concept of movement. And so I'll actually move to the next question, which is, how are you incorporating movement in your team's day to day? And at the lack of this sounding strange, it's, you know, movement from a standpoint of not just physical, but even mental, just making sure you're working your mind and your body. So Jackie, I know you've done some really awesome things with physical health and been able to have a broader reach. So I'd love to hear a little bit from you about what you're doing over at Snap with this transition.
Yeah, thanks, Kaleana, for the question. Very similar to Emmaline, we also converted all our on-site classes across the globe to virtual. So any team member or family member can join classes Sunday to Friday, multiple times a day, you know, doing things like Pilates, yoga, boxing, stretching. We also implemented a family HIIT class, which has been really popular, and we themed it every week. So next week, we're going to be having a Pride theme HIIT class so the whole family can join in. So that's been very popular. At Snap, we definitely have a culture of supporting flexibility and breaks. It's more important than ever now that, you know, everything is happening at home, and it's really important, you know, to take breaks and disconnect from work to improve your productivity. So we have a ton of guides for managers and teams to check in with each other. Team builders. On the wellness side, we offer like sound bath meditations that you can do for 10 minutes or desk yoga, and just trying to find ways to connect, not just through work, but also personal life. So we've done things like providing opportunities to volunteer, whether it's creating cards with your kids for frontline workers, family activities, poetry, writing practice. I did an improv one the other day, and that was really nice to just get out of my zone and do some silly stuff to take a break from work. And Headspace has just been a huge partner for us. We've seen our enrollment increase almost 40% since we started working from home, and now over a third of our team members are using Headspace, which is really amazing. And they've been able to help us with, you know, opportunities to take 1-minute meditation breaks, but now they offer mindful workouts, and the sleep stuff that Lindsay mentioned has been super helpful for me. I actually used it last night. So those are some opportunities we offer our employees.
That's great. I love that. And I think, you know, when we're talking about taking a lot of this virtual, that concept of incorporating the whole family, I think is really, really important. I've always heard from our clients that you're trying to get a hold of the dependents in their listening ear, and now is the chance. It's the time to pull them in. So Celeste, I don't know if you want to touch really quickly on that. I know that you've done some interesting things in terms of survey and feedback and whatnot. So how have you been thinking about, you know, getting your teams to move and interact and you know, just get out of the seat every so often during the day?
Yeah, well, you know, Crossover offers our integrated primary care to our employees. So we have a full physical medicine arm, and a lot of the things that Stephen talked about that we're offering to our clients are actually available to our employees. So we've got the programs there. What I found is just the way that we've had to pivot to virtual. It's really about making sure that people know it's available to them, promoting it, promoting you know, peer-to-peer support as well, to take advantage of some of the tools that we have for them, including all the physical medicine opportunities that we make available to not only our clients, but our employees.
That's great. I love that. And I feel like I'd be remiss if I didn't touch on this topic because it is so timely, and this came up as one of the big stressors and heavy topics that was referred to at the beginning of this session. But how are your companies thinking about diversity and inclusion and social impact as part of your programming during this time? I mean, when we talk about well-being programs, we're really talking about taking care of our people, but who they are beyond the workplace. And this move remote has allowed us to see who a lot of people are, outside of the typical day-to-day office. So Celeste, I'd love to start with you. I know you've done some amazing things around corporate social responsibility, and then hear from some of the rest of you, because I know this is something a lot of our listeners right now are really curious about.
Yeah, we've been running focus groups so that we're engaging with the employees to find out what's most important to them, how they feel, what resources they need. We also have just an incredible behavioral health team that is putting together programs for our clients that are touching on the impact of what's going on in society right now, and actually whole programs around that. And again, because we are putting these together for our clients, these are also resources that are available to our employees, as also being able to utilize all of our services. We're also engaging our leadership team and forming councils, diversity, inclusion, and quality councils. And, it's just been really awesome to be able to open up the dialogue, find out specifically at different, local sites what it is that they want to do. Our employees have told us they really want to have an impact in the communities that we serve. So we're able to do that, of course, through the healthcare that we provide through the employers, but also they want to be able to give back. So we're looking at different ways to do that for, just across the company and engaging our employees.
That's great. And then Jackie, I know we were talking about this yesterday over at SNAP. You guys have done some amazing things for mental health. I love the Pride dance class and things like that. What's maybe one thing that you've been really proud of, how you've incorporated some diversity and inclusion or thinking about that in your programming?
So on the benefits and wellness side, we've definitely just been working a lot with our vendors just to make sure that they're able to support a diverse population. It really started off with COVID, how can you help provide support to our employees when there's so much fear with COVID happening around the world. And then with everything that's happening now with the events of social injustice, a lot of our communities, just feel very, very vulnerable and are in a lot of pain. So we're definitely just been challenging a lot of our partners to make sure they step up with us to make sure to provide that customized support. I know, us in the benefits field and just in the benefits industry, we always have that approach of, let's implement the programs that impact everyone, which totally makes sense because we're spending a ton of money and we want to make sure it impacts everybody. But, if you're a company that's offering specialized programs for parents, why not offer specialized programs for your Black employees or your Latinx employees? And I think that's a lens that we should all take. So on the SNAP side, we're very close to solidifying partnerships with companies that do offer specialized programs for minority communities, whether it's like meditation or mental health therapy.
That's awesome. And I know we're getting a little tight on time as we wrap it up, but Emmaline, I'd love to have you just bring us home with 30 seconds. If you can just highlight one thing that you've been doing or thinking forward about diversity and inclusion at Dropbox.
Yeah, so our D&I team has really been rock stars throughout all of this, hosting town halls, addressing how we can support their team's work and also our Black community. We actually hosted a day of reflection a couple of weeks ago where Drew, our CEO, encouraged employees to take that time to do whatever is most valuable to them, whether that be volunteering, reading, taking a moment just to process everything that's happened over these past several weeks. And we also have some fun events coming up to just really kind of like bring a little joy to everyone during these difficult times. We have a fun Juneteenth trivia happening on Friday. We are celebrating Pride Month as well with a few fun workouts and different things like that.
Perfect. I love all of these ideas, and I think that, you know, something that's really special is I get to work, you know, Jackie and Emmaline and Celeste alongside of you. So please, if you have any more questions about this, put this in the chat. We'll get back to all of you with these ideas and more. So thank you, ladies. Michele, I'll pass it over to you.
Awesome. Thank you. Fantastic stuff. Again, thank you to the panelists, Lindsay, Jordan, Jocelyn, Dr. Stephen. Love it. Thanks for being part of this. It's been really insightful, both the prep and the session today, and to our client panelists. Appreciate your time and sharing. It really is what's big part, the heart and soul of this webinar series, is getting the different voices and experiences. Our next webinar topic is on the 25th of June. It actually has a focus on the kind of risk side of COVID and returning to work around workers' comp. A lot of changes happening. How are underwriters responding? What do employers need to do? So this is a good one, particularly for some of the legal and risk folks, but also HR needs to be in the know on this stuff. So come check it out. That registration's live now. Sequoia Return to Work Playbook, just because people keep asking, you can find it on sequoia.com on the Return to Work page. Pretty easy, so it's right there. And again, thank you guys. We love having you part of this dialogue, and it really is the joy of doing these is reaching out and getting folks to participate. You're so generous with your time and your insights, and that's amazing about our community. So look forward to catching up with you guys. Thank you, Kaleana. Thank you, Camille, who's always behind the curtain, our presenters today, and everyone have a great end of the week, and we'll talk again soon. Be well.